So Amanda, would you introduce yourself and tell us about the work that you do?
Great, thank you. My name is Amanda Starc, and my research agenda sits at the intersection of industrial organization and health economics. Basically, I use healthcare markets to understand general economic phenomena, while at the same time, I use economic concepts to better evaluate the performance of healthcare markets.
So what's the problem that we're focused on here?
So we document something that many consumers already know, which is the fact that the price of drugs can vary substantially across pharmacies. As a result, there's significant scope for consumers to lower their drug cost if they're willing to fill their prescriptions at particular locations. And insurers play an important role here because they can create preferred pharmacy networks with selective contracts and offer lower copays at preferred pharmacies.
So what are you recommending? What's the specific intervention we want to see here?
So we already see an intervention that we can evaluate, which is in the Medicare Part D market, plans introduce these preferred pharmacy networks. These plans direct consumers to lower cost pharmacies by providing them with lower copays if they fill their drugs at that preferred pharmacy. We find that these preferred networks reduce spending on prescription drugs by approximately 2%. Now, of course, you could be worried that when a plan adopts a preferred pharmacy network, consumers may have to travel farther to get to preferred pharmacies, or they may be less likely to fill drugs. And in fact, the closest preferred pharmacy is a little bit further from the average Medicare beneficiary than the closest in-network pharmacy. But what we find is that the average beneficiary doesn't actually end up traveling much further in practice when her plan adopts a preferred pharmacy network. And in fact, that consumer is made better off due to reduced out-of-pocket cost at preferred pharmacies. As a result, we argue that expanded use of preferred pharmacy networks within a range of private insurance products will lower drug costs without reducing consumers' access at pharmacies.
If we put this in place, if we shifted everyone to preferred pharmacy networks, what kind of savings are we talking about?
So what's interesting is that while about 95% of Medicare Part D insurers use preferred pharmacy networks, only about half of employers are using either narrow or preferred pharmacy networks. Within the Medicare Part D context, we estimate that these preferred networks lower drug costs by approximately 2%. If we expanded the use of these preferred pharmacy networks, lower drug spending amongst the employers would lower drug spending by more than about $1.3 billion, or approximately 0.4% of the total expenditures in the US on retail prescription drugs.